Hello, everyone, and welcome to the first Fireside Chat of 2022 for Derryfield School. I'm Mary Halpin Carter, and I'm the head of school. And I have with me tonight our wonderful consultant, Mike Klingshirn from Fusion Cell, which is our epidemiology public health consulting organization. And tonight we're going to talk to you a little bit about how the COVID-19 picture is looking in the state at this moment, and then how that relates to Derryfield School. In my remarks, I'm going to walk through with you sort of why we're having a prudent phase to start 2022, our deep commitment to on-campus learning and why we think we'll be set up so well for that, and sort of glimpsing at where we are during prudent phase and then what's to come. So I'd like to welcome Mike Klingshirn. Mike, can you join us? Hi there. So Mike, if you could just introduce yourself for the families at home who are new this year, that would be wonderful.
Hi, families. My name is Mike Klingshirn. I'm an epidemiologist. I spent the first 10 years of my career as an epidemiologist with the United States Air Force. I did the public health officer thing. I have been all over the world doing disease prevention, disease mitigation, and giving our leaders and our commanders different courses of action that are based on risk and benefit, and helping derive the right answer for the right solution for the right situation. And so that's exactly the skill set that I've brought to the table. We've got a team of probably 15 or 17 experts behind me, all with the same or similar military background. And we have been helping and coordinating with the Derryfield School since probably March of 2020. So almost 2 years now. And it has been sometimes a bumpy journey, but we have gotten here and we've had some pretty darn good success over the last 2 years.
Yes, we have. That is so true. And so Mike's going to give us a little bit of context to understand from a public health epidemiology point of view where New Hampshire and our region is. And then I'll speak, and then I'll also take questions in the Q&A at the end of our sort of prepared remarks. We'll be answering questions. So as they appear to you, or as you think of a question, you can write it in the chat, or you could write it down, see if it gets answered in our remarks, and then offer the question up at the end. So Mike, take it away.
Well, thank you. It has been a little bit since our last Fireside Chat. This is the first one of the year, so 100% of the Fireside Chats in 2022 I've been on. So I'd like to recap just kind of where we've been and where we're going, and hopefully shed a little bit of an epi perspective on what we're looking at in the state case-wise, how hospitalization and utilization is trending, look at some studies from the international community, and then bring it back home on some of the real risks that are out there as we come back from our travel season that we've just had, our holiday season, and as we welcome each other back into a community. And so since about August, we've seen this gentle upward climb in cases, and we've been tracking it and trying to figure out, is it going to peak? Is it going to plateau? When is the very tippy top? And we saw the tip last year, right at the end of December, early January, cases right around 60 to 62 per 100,000 in the state of New Hampshire. And then as January hit, a decline up until about March, April, a little bit of a plateau, and then back into the summer months where we enjoyed a very nice, very low case rate, down into like the 2s and 3s and 9s, those single digit numbers that are very beautiful, especially for an epidemiologist. Then as late June, July, we got into August and reopening, and that's when Delta started to pick up. And so that was that steady climb. Roughly once every 14 days, we saw a new peak, and then a little bit of a dip, and then a new peak. So on this 14 to 20 day swing of behaviors, and it could be when things are reported, it could be when testing is happening, it could coincide with weekends. There's a lot of things that go with those so that you don't see these steady numbers. You see kind of trends. But our last big peak was in December. So it was December 10th, depending on what data set you look at. And we have been past that 14-day mark, that 10 to 14 day mark, and we have not hit another peak up, which is a good sign. That means that we may have plateaued, although we still see large numbers of cases on the daily case count. The fact that we have not seen another swing up past that peak is a very good indicator. Now, I'm going to knock on wood because I'm not anything other than a glorified weatherman at this point, and everything is subject to change. But from the way that it's looking, we might be able to start that decline hopefully soon. And I want to make sure that we're prepped and ready for it. But the idea is that we need to understand what the international models are saying. And so when we look at South Africa, we see that as people got Omicron, the numbers of hospitalizations mirrored what we saw with Delta. But for the people that were hospitalized, there was far fewer people that were in ICUs and far fewer people on ventilators, which is a great sign. So the question is Omicron less severe? Is it something that's more in tune with being called the common cold? And I wouldn't go so far as to say it's the common cold, because we still do see hospitalizations and people seeking treatment for COVID. But we don't see as many of those significant and adverse health events, at least in South Africa. What the United Kingdom did is they kind of separated out that data so they could say who is being treated for COVID, so because of COVID, and who's being treated for something else, but COVID just happens to be present in that population. So those are two distinct markers that we don't have access to in the United States. And so the Omicron and the Delta numbers are roughly equal in the UK for people being treated for COVID. But they are a little bit more prevalent on Omicron just being present in the hospitalized population. So people not seeking treatment. So it may skew the numbers a little bit, but it gives you a little insight when you compare Delta and Omicron, that they're similar in hospitalizations, but those adverse, those bigger events, the ICU and ventilators seem to not be as used. So you get a little more capability in those senses. And if you look at how the trend in New Hampshire is specifically, we saw roughly in November, December timeframe, early December, about 3% of ICU beds being left available, which means that we were talking, do we need to send people to other states for treatment? And that's a big issue. And right now, there's about 90% usage, down from 97% at our peak. So we have more ICU beds. We still have ventilators available, and we're getting more bed space. So probably about 85 to 87% of bed space overall has been used. So we're seeing more availability of care, more access to care, things opening up even with these large increases in numbers. So I think we're trending in the right direction. Remember that hospitalizations typically follow what's happening case-wise by about 2 weeks. So that's kind of what we've seen at the international level, how we brought it back. But thinking forward about events in our lives that may have increased our risk for being exposed. And so holiday season, New Year's travel, depending on what states you went to, if you did go out of state. And Johns Hopkins puts out a very good list of states and kind of gives their trends. So New York, New Jersey, Florida, Puerto Rico, Hawaii, all these nice, well, maybe not New Jersey, but all these other nice places to go to. I currently live in Florida, so I know what this trend looks like in my state because it is basically straight up right now. So we've dealt with our Delta phase, and now we're in our Omicron phase, and we're seeing straight up transmission, 250% increases over the last 2 weeks. So there are states that have done well, and there are states that really embrace Delta, but are now embracing Omicron as well. And so there's definite risks. So as we think about travel and we think about why we would talk about a 2-week quarantine period or a prudent phase, really what the idea is is to reset the baseline at Derryfield School, to reset and make sure that we're as prepped, that we have gone through a 2-week quarantine, a actual 2-week quarantine, and we're ready to start the school year in person on the right foot, and we can go forward with a lot of confidence. And comparing this to what we did last year, we didn't have a prudent phase after Thanksgiving. We're not planning on a prudent phase as we get into the spring break timeframe. So this is a one-time reset. It's to kind of recollect ourselves after this big spike and make sure that we can all be on that same page. We can all be as safe as possible. And we're not hurrying and rushing and trying to get testing done. And we have time to accomplish the tests that we need to accomplish while we still support the academic outcomes for students.
Mike, there was one other element that you talked to me about a little bit, which is that even though there are smaller numbers of people having more serious experiences with their hospitalization with Omicron, that possibly is offset by the large number of infections. So, and then there's this added risk that potentially Omicron mutates and it becomes different in some way that is hard to know whether it's more impactful, less impactful. In other words, this is not the time to just kind of get over it and let it go. Do you want to comment?
Yeah, great point. So when we see something that's highly contagious, even though it may not cause a large number of hospitalizations, say it's only 2%, but when you have a lot of infections and almost exponential growth, you would expect hospitalizations, even as a small portion of that, to follow that same growth pattern. And so the idea of hospital utilization going up, potentially a few weeks after you see these big spikes, is a very real outcome. So what we saw last year during the Delta spike, specifically in Florida, was hospitals relying on the emergency management system because they ran out or running short on oxygen. Miami had those calls. We saw pediatric cases rise in Orlando. Pediatric cases in New York seem to be skyrocketing right now. So it's not that it's a mild disease. I think we still need to be very conscious in the decisions that we make, and kind of keep that futuristic look of every new infection is a potential for a mutation. Not that one infection is going to make or break the history of COVID as we look back on it, but we want to limit the number of potential mutations as much as we possibly can. So that means taking steps in our daily lives in ways that we can stay healthy and reduce risk, and also reduce the risk of those around us.
Great, thank you, Mike. So I'm going to talk a little bit about the prudent phase itself. And as Mike referenced, it's a 2-week reset because we are determined to open and stay open through the winter trimester. Derryfield is really a safe and caring community. We're also a wise and brave community. And so our approach all through this pandemic has been keeping all of those values in place with our decision making. We're the school that announced that we would be open before any others in June of 2020 because we had done so much planning. And we, in fact, had great success through the 2020-21 year being open with a few prudent phases. Returning in August of this fall, cases were low and we returned to most of the Derryfield experience so that it was as similar to 2019 as we could make it. And that included using all of our upper school classrooms and having masks optional in classrooms where faculty were supervising. And it was a successful fall, even as cases in the outside world increased. In mid-December, though, as Mike referenced, cases spiked as we were going on vacation, and we could look forward to January 22 and see a time of uncertainty. And as he mentioned, students mixing and mingling with family and friends, as should happen during the holidays and during a vacation, the variant appearing, and then also knowing that folks would be traveling in public spaces. So because we're so deeply committed to on-campus learning, We want to set up the winter trimester to be high quality and on campus. I want you to understand that our leadership team deeply understands how inconvenient this is for families, that especially middle school families who are arranging for childcare, or families who have challenging home circumstances, or families whose kids are disappointed because they can't make it to campus for sports, and also for students who have learning styles that make it more difficult for them to be virtual than in person. So it was a hard decision and a really carefully thought through decision. We also know that we are being more cautious than other schools because we see winter trimester as a marathon that we want to finish open and thriving. We do not want to see this as a series of weekly sprints where we're worrying about how many positive cases have emerged that week and what it means. So that idea of the long-term view of the entire winter trimester is really at the top of our mind. The other thing that's at the top of mind is that other schools may stay open and have been open through the fall, but within inferior learning environments, because so many faculty or staff were out due to sickness or the quarantining. We feel it's better to be prudent and keep everyone healthy and then have as many people back on campus as we can. So we're asking you to invest this time with us so that students, and in fact, students will only have about 4 to 5 classes a course that are virtual in the sweep of the entire winter trimester. So our aim is to get the number of cases in our community as close to 0 through 2 weeks at home, through a test for every member of the community, a negative COVID test before returning. Then we return to campus and have an ongoing testing program that I'll talk a little bit about in a minute. We remember also that many of our community members have immunocompromised household members. They live with people who are cancer survivors, with grandparents, or with very young household members who are ineligible for vaccines. A significant key to keeping our school open and high quality is the faculty and staff. We love our faculty and staff, and we are deeply concerned about their health. We're also practically really need for them to be healthy to come into school. And we also want to make sure that they have confidence in their safety. So the Prudent Phase and the testing program are all going to hopefully protect our on-campus experience, and especially our faculty and our staff. So especially our faculty and staff with kids who are under the age of 5, who are too little to be vaccinated. We have a number of faculty who have families that are young. They need to feel comfortable teaching. Some were not at the end of December. Substitute teachers and bus drivers are in short supply nationally. They're also in short supply in our area. Many of the folks who used to be substitute teachers and bus drivers for us were retired people, and those folks are not willing to work in the pandemic, or some of them are not. We've actually invested in hiring a number of substitute teachers to be long-term permanent hires. So we've proactively hired the subs to be full-time rather than day-to-day, so that we have a bench of folks to rely on. But we can't exceed that team because there aren't more subs to be had in the state. Similarly, bus drivers are in short supply. So a healthy faculty and staff equals the best possible student experience. And similarly, conversely, the greatest threat to our in-person learning is if too many faculty and staff were to need to stay home. So that's also a practical element as we think about what we're doing. But if we follow the protocols, mask wearing, Magnus, not coming to school when we have symptoms, then we're not going to need to worry. So what will school be like for the next 2 weeks? Well, we know that Derryfield, and those of you who are new and had virtual learning experiences at other schools, please bring an open mind, because we have done stellar virtual learning in our prudent phases of last year. Derryfield teachers did a terrific job and received many kudos for their online classes. This year, we've actually improved what that virtual 2 weeks will look like, in that we have more advisory touch points, 5 advisory touch points in the next 2 weeks so we can check in with our advisees, make sure they're doing well, and have a bit of fun. Our lead, our explorations courses, community meeting are all going to be happening during the Prudent Phase. There was a meeting this morning, and I want to thank all of the students and students and parents for making sure that students were present. We had almost perfect attendance in the middle school meeting for students led by middle school head Mark Blaisdell, and in the upper school meeting for upper school students led by Raina Stimpson. So, and at those meetings, kids heard about the high expectations that we have for being engaged and participating through this Prudent Phase. Though we also, in our similar meetings with faculty and staff, talked about the importance of patience and understanding of faculty towards students who are adapting to a different mode of learning. And so together, faculty and staff with students are going to work together to make this successful. Our student leaders, we had a special meeting with them this afternoon as well. They're going to be providing additional feedback with suggestions for additional ways to make school better when we come back to school. And they will be working on an instructional video that will help kids learn how we might return to campus, bring our best selves. A question that's arisen is about snow days during the Prudent Phase, and there are no snow days during the Prudent Phase. The reason we have snow days are because travel to school would be dangerous in the morning or in the afternoon. So we don't need them during the Prudent Phase. However, the weather team at Derryfield is going to make the call about afternoon activities during Prudent Phase. So there may be a suspension of an afternoon activities if the roads were dangerous one day. So what are we adapting? What are some adaptations that we're making in the Prudent Phase? Well, the first one to talk about is spectators at games. We've had masking required for parents and students who attend games. Because the number of new cases per 100,000 people over a 7 or 14-day period has elevated so high in the state, we are going to going forward until further notice. Parents are welcome to come to games. Students are welcome to sit with their parents to watch games in family groups, separated by 3 to 6 feet from other families. However, students cannot come to games right now in a student section until numbers drop below about 60 cases per 100,000. That is particularly disappointing to me. I love seeing students turning out to watch and cheer on their friends at games. Students who are at higher risk due to Derryfield activities, and this would include students in the musical, in indoor sports, they're going to be tested 3 times during the Prudent Phase before returning to campus on the 18th. So that would be kids in basketball, in the musical, in hockey. And all students, before they return to campus on January 18th, will provide a negative COVID test, and that needs to be entered into the Magnus app during this next week, the week before we return next week. If you would like to have your child tested here at Derryfield for free, you can do that. We would be happy to have you do that next week. Just check nuts and bolts, which will be coming out on Wednesday for more information. So now let's shift and think about the return to campus, the real reset on January 18th. So as we think about that, we know that because the case numbers are so high in the state, we have to work to work at our safety layers of health safety layers. We've got to sort of increase those. And we also have to make it easier, or we plan to make it easier to do the right thing in staying home if you have any symptoms until you have a negative COVID test. So let's talk about the first one. Full indoor masking will be on campus. The only exceptions will be for lunch, for performances, and for games, for say basketball games. And we will be looking at that until we see a drop in COVID cases. Again, we add layers as we go up, and we love peeling them off as the case numbers go down. Parents, please be sure that your student has a series of masks that really fit their faces. The really important thing is that they fit all around, across the nose, they don't fall down under the chin. An excuse that is not going to fly is that my mask won't stay up. So we're going to really execute on following through, making sure that every student understands that there are consequences if you do not keep your mask over your nose and on. We've had excellent cooperation around that, and I expect that to keep going. Please, this is the most important thing. Please stay home if you have any symptoms. The number of symptoms, and Mike can remind us of them when he comes back on, that possibly could be COVID are so many. It's almost any time you don't feel well. Stomach ache could be COVID. Sniffles could be COVID. Headache could be COVID. And I'm afraid that in order for us to really keep our school safe, we've got to stay home until we get tested to be sure. We've got to prove it's not COVID before we come back to school. And in December, we really learned that that was our area of greatest vulnerability. Kids coming back to school with symptoms, and kids, especially outside of school, visiting one another when they had symptoms. That cannot happen either. It made some classmates understandably mad that there were classmates who were coming to school with symptoms. You got to stay home. So we had what the state would call a cluster of cases that last week of December before we came back to school, which is a disease transmission of 3 kids or 3 people or more. And we know that even mildly symptomatic people can pass COVID to one another. And I think what happened in December is that there was pandemic fatigue, which is completely understandable. We are all sick of hearing about this. However, 5 students got sick. From the tracing the research that was done around the tracing, we don't think there was any transmission in class or in the afternoon activity that some of the students were in. It seems like the contact tracing showed that it was outside social time. So the key is, please don't socialize outside of school if you have symptoms either. We're going to be all about testing and checking for our symptoms. So here's a reset moment as we come back to school on the 18th. If you've been allowing your kids to fill out Magnus, let's do a reset. Please ask them the questions and please take their temperature. Magnus is designed so there's an interaction between 2 people in order to really have people stop, think, do I really feel well? Has this been a slow decline and I'm not paying attention and I don't realize that I don't feel that well, and making sure that temperature is taken. So this is really sort of mission aligned as well. Part of Derryfield's mission is to inspire bright, motivated students to become their best and also to become stellar members of any community. Being the best in our community right now means staying home if you have symptoms. So how are we going to make it easier to do the right thing when you're really worried about getting behind in your academics? Totally understandable. Derryfield moves at a fast pace. That's part of being in a school like this with high academic standards. So a couple of tools and touch points are going to be in place to support homebound students. First is on the Derryfield website in what we call MSA. This is an amazing thing. This would have helped me and all of my children had this existed back when we were all in school. There is a daily plan for each class, and that daily plan is like an agenda with links to the materials, the assignments, everything that happened in that class plus the homework. So it's almost like you're the teacher and you can see everything and you have access to everything that anybody who was in class had. The second thing, which is new that we are adding, is what I would call a balcony seat view of class through Zoom. So when we have not been, we really wanted to return to classes that are engaging and are student-centered and are about active learning, because we know for a whole host of reasons that you all know that produces the lasting learning. However, at each class, the teacher is going to have Zoom set up. We'll have a microphone and a camera in each classroom. And it will not be designed, the class won't be designed to be in front of a camera like I am with you now. It'll be that the camera's on, the sound is on, and maybe kids are working in groups around the room, and the student at home can just listen in, or the student can see part of what's happening, but at least it will help augment that daily plan and give a student who's feeling well the chance to listen in if that student would like to. Again, we also want students to get better and feel free to be sick and rest and completely get better and not worry either. Excuse me. A third tool and touch point that's available for students who are homebound is that they can meet virtually with their teachers for academic extra help. That's built into the schedule and will be present when we come back. And then the fourth is that they have time to meet with classmates for collaboration that's built into the regular schedule. So if they want to touch base with a classmate and catch up, they can. If your child is truly ill, we will work with you to try to figure out how to help that child catch up. There are many ways that we can work with a student so that student doesn't fall behind. The key is really good communication with the advisor. Another element that we are introducing to really make our back to school on the 18th successful is testing. It's a new testing program. We had testing last year. This one's slightly different. So 100% of our community members will be tested coming out of the gate on the 18th. And then 50% each week. We're going to alternate due to the high vaccination rate. Students at higher risk due to indoor sports, musicals, or other activities will be tested weekly, every week. And we can increase or decrease that testing rate depending on how things are going in the community. So a couple things, I've sort of described what happened, why we're having Prudent Phase, what to expect during Prudent Phase, and then what to expect when we come back on campus together. There are a couple things we're still working on that would be during the Prudent Phase to be instituted after January 18th. And those include dedensifying some spaces. As I mentioned, we did in August, case numbers were so low that we designed school around the way we did it in 2019, as normal as possible. We are going to be looking at now at community meeting seating, upper school lunch, and classes that need bigger spaces, all of those under the heading of dedensifying, how to create kind of more space, more distance between people. Great, so I'm going to take a look, and Mike, if you could join me back, that would be wonderful. I'm going to be looking at some of the questions here in the Q&A. So a question, you spoke of the spike on December 10th. Did the Derryfield population follow this spike in cases? I wouldn't say that. Mike, how would you describe it?
Well, I will say that there is a correlation, maybe not a direct causation, but definitely a correlation between the spike on December 10th and the cluster of cases that happened on December 14th. And so, as we know, when those external pressures, the cases in the external community are extremely high, and in that period it was over 100 per 100,000. For reference, our biggest spike in the 2020 year was about 60 per 100,000. So we were, oh gosh, public math, at least 50% more cases in the community than we saw last year. And so that's when we saw the not just a case popping up in Derryfield, but a potential spread within the Derryfield academic day. And so as we talked about, some of the biggest things that we identified as needing a little bit of improvement are not coming in when you're symptomatic, and even mild symptoms. And I think that this is the biggest piece and my biggest takeaway, and definitely a huge talking point with 4 different schools today, has been around mild symptoms and not having those folks in the community during the day, because mild symptoms mean that you're contagious. And as we know, if you have an exposure and you are named as a close contact and you develop signs and symptoms, some of the studies that are out there point to about a 90% probability that you will develop COVID. Alternatively, if you are named as a close contact and you can make it till about day 7, day 8, and you're asymptomatic, there's about a 90% probability you will not have COVID. And so those numbers, they kind of speak for themselves, and they really highlight why we say, if you become symptomatic with things that look like COVID, stay home and get tested, because those are the highest risk of transmissions. It's not so much the asymptomatic folks that we're learning about. It's more these symptoms, those mechanisms where we have, propulsions that come out of our body and get close to other people. And Dr. Carter asked me to talk a little bit about the signs and symptoms. So with Delta, we saw some lung tissue infiltration. We saw a lot of stuff in the respiratory tract, upper respiratory, lower respiratory. The way that it infected the lung tissues was unique. With Omicron, it's not as effective at attacking those lung tissues. So it's more in your throat, it's in your respiratory tract. So it's up here. And so when we think about the typical shortness of breath, that may not be one of the major signs and symptoms of Omicron. So these are, when we're talking about sore throats, coughing, we're talking runny nose, headaches, things that you would associate with an upper respiratory tract infection. But then also body aches, nausea, vomiting, diarrhea. These are all typical things. And as we know, it's not just COVID that's out there. We're also in cold and flu season. So going out and getting a COVID test when you're symptomatic helps us eliminate COVID as that route of exposure, is that potential, and get a differential in maybe it's the flu and we just have to stay out for 3 days and have a fever reduction and we're back in. And so just keeping an eye on that. And staying attuned to those changes in our health status is the biggest piece. And if there's anything, if there's a question, if you see a runny nose, just stay home, get it looked at, and go virtual for a day, and just let everyone know. There's no shame in saying, I'm going to take the day off and go over here, because if you can prevent an infection in somebody else and them being out for 5 days, it's definitely worth it.
Here's a question that I'm so glad is asked, because it reminds me of something that I meant to say originally. Once students return to in-person learning, will DS continue to permit students to come to school even after being exposed to COVID by a household member, recognizing these are CDC guidelines? So the answer to that, Mike, go ahead and answer that, and then I'll tell you what I was thinking of regarding tracing. So go right ahead, Mike.
Yeah, so as of today, and this is subject to change, there's a big call between New Hampshire and all the schools to discuss what the CDC put out on the 27th of December. So that change in the isolation guidelines that the CDC has, the change in the quarantine guidelines. And so for right now, those guidelines are still what the state had. So if you are ill, it's still 10 days. If you are an unvaccinated household contact, it's still 10 days, or 7 with a test. If you are vaccinated, you can still be in, but it's a universal masking protocol because of that defined exposure, that close contact. And anytime that you are named as a close contact and you are in the Derryfield school for 14 days, that's when we're monitoring for those signs and symptoms, because we know that that's that critical indicator. One of those early warnings on whether or not we are going to develop a COVID infection or be asymptomatic or no COVID infection at all. So testing can be augmented. We can have those targeted testing programs through the testing solution that we have this year, where close contacts can be tested, and we can flex, as Dr. Carter said, up and down based on the need of the population. But as we are in those quarantine phases or an alternative to isolation, we have to be very, very, very in tune with what's going on with our health status, because any symptom puts those around you at risk. And I think that we all know this, but it's something that happened last year. It was mildly symptomatic folks that came in, and whether it was one exposure on campus or one exposure outside, they both came with some risk, and there's a potential there. So that's kind of the difficulty of contact tracing, is there's never a smoking gun. So you got to kind of play with the data and the data sets and see what happened to those around it. So it's one of those things where even if we switch those guidelines, that idea of symptomatic individuals staying home has to be reemphasized and adhered to make sure that that protocol works. Because without that, it will fail. I will guarantee that.
So what Mike is mentioning, which is another element that's new, is that we will be, when our wonderful nurse, Lainey Shaughnessy, contact traces from a person who's got a positive test, the people, if there are students or faculty in the community who are identified as close contacts, they will be tested at that point. So that hopefully will be a nice extra layer of protection as well. As Mike was saying. Here's a question. I'm sorry, I may have missed this. Did you say that the students need a PCR or an antigen COVID test prior to returning to the school?
Yep. So the right test is the one that's available. So if you can get a PCR, and I know Derryfield is going to offer those at no cost. If you go to your physician and you do a point of care test and you have access to a rapid or a PCR within a couple days, anytime within that 2-week period, anytime on the second week of that 2-week period, is going to really lend a lot of credence to the effectiveness of that quarantine protocol that we're building in, that Prudent Phase protocol. So I would say that the right test is the one that you have access to.
Yes, so there are a couple questions that are related to this. So how can my child get tested at school before the 18th? That can be arranged. And again, this is one of those moments where I sort of have the big picture, and there are other people who have much deeper knowledge of the details of how to arrange that test exactly next week. It can be any day next week, I believe, on campus, as long as there's space. Nuts and bolts on Wednesday will give you information on how you arrange that test for next week. And another question said, can the kids go to school and get tested one day next week? Yeah. So you have a choice. We wanted to make it a choice for families. For some families, it might be easier for them to get their child tested themselves. For other families, it's easier for them to get tested at school. So that choice is up to you. Let's see, how many days returning to school can a negative COVID test be submitted? Any day.
So how many days prior to the start of the school week?
I think that's it.
Yep. So I think this is a unique situation because this Prudent Phase is a 2-week warranty. So anytime in that second week gives us a lot of confidence in not just the time that we're spending in a relative quarantine, but also the effectiveness that we're not going out and having those high risk exposures, even with those huge external pressures, those large case numbers in the community. And so anytime on that second week, the closer you can get it to the start of school, the better it is. But because we're building in a 2-week Prudent Phase, it can be anytime during that second week.
Great. Here's a question. Are N95 masks allowed? Of course. Absolutely. Correct, Mike?
Yes. So I will just put it out there that N95s are considered respirators and not masks. So they give you a lot of personal protection, but to be the most effective that they can, usually they come with an annual fit test requirement on the make and the model. Outside of that, the one that fits the face the best will absolutely give you protection above what a surgical mask would do and above what a cloth mask would do. But what I will say is that without a fit test, you can't guarantee that it's going to be exactly 95% of those small particles. So you might have some infiltration around the face. So those fit tests are pretty critical for the rating of N95. However, without it, they're still pretty darn good.
So this is a little bit of a repetitive question, but I think it's important to ask anyway, because this information is confusing. So the quarantine period in the US and Europe has been decreased to 5 to 7 days from 2 weeks last year. Why are we still following the old quarantine period instead of revised smaller period? Thank you.
Yeah, that's a great question. And so the idea is that we could do a 5-day quarantine period. We could do a 7-day with the test. We could do a 10-day. But when we talk about a 10-day, it's basically a 2-week period anyway. And so knowing what test availability is looking like, the scarcity of tests, and then those big external pressures. If we go 2 weeks, we give things a chance to calm down in the state. And we also help build in and reemphasize that we are about as low risk when we start as possible. So given the pressures, given the transmissibility of Omicron, given the high case rates, and especially in neighboring states as well, I think it's definitely worth it. And that's all things that have gone into that deliberate decision-making process of why would it be 2 weeks? Why not 1 week? Why not a day? And so we could potentially do a shortened quarantine phase, but it may bring some extra risk in it. And so the idea of building it out a little bit longer to make it a little bit safer has been the overwhelming majority of what we've come to decide on.
Why wouldn't Derryfield stop indoor sports and other practices like the musical during this 2-week pause?
Yeah, great question. So we do know that there's an increased risk. We know that these are some of the higher risk sports. And so during this 2-week pause, the idea is that we're practicing together. We're making progress in our skill sets. The idea is that we can even have competitions in basketball with other schools. And I know that it kind of seems like a double standard, but the way that we have decided on this is that these are sports that are going to happen, and they're going to happen as a group on campus, but we don't have the rest of the Derryfield community there. So the risk, the spread is limited to just those families that have accepted the risk that this is the sport that my student wants to play. We accept the risk of playing against other schools. And so we've talked a lot with Chris and what other athletic directors are doing in the community and how we can make it safer. Can we require masks, and if not? How do we build in testing strategies to see and limit spread just in case something does happen on another team? And so we're using the principles of a targeted and layered approach in this little bubble that's going to happen outside of the setting while everybody's remote. And so it has been a deliberate risk acceptance by the parents of those students, and we're making it as safe as possible.
Another note on that is that it's been made very clear that it is completely optional for any student to play those sports or to be going to musical rehearsal in this 2-week period. There's no penalty. They have full credit for those activities. Here's another one. Recent studies have shown throat swabs or spit tests are more sensitive in detecting Omicron compared to nasal swabs. Will you be doing spit tests again this winter? Nasal swabs have a higher false negative rate for Omicron.
Yeah, that's definitely a great observation. And we talked about, that upper respiratory tract, the throat stuff versus the lungs and how we breathe. And right now we are still doing the nasal swab. That's the option that's available through this testing option. So just because it's less sensitive doesn't mean that it's not going to pick anything up. So I think that it's still sensitive enough. It may not be 100%, but if we can get to a 95% solution, we will still be better at risk reduction. We'll be able to stop that risk of transmission. And remember that we're doing this in the beginning as a surveillance program, but as we progress past that second week, it's going to be very targeted. And so we know the students that we're going to be testing, and we know, okay, this person was a close contact, and we're watching for those signs and symptoms, and we're going to test if they're symptomatic individuals. We can also do some tests on the asymptomatic if needed to verify those health statuses. But if somebody's symptomatic, we have the option to test, and we know that those are the highest probability of having positives. And so it's a test to see if it's COVID, but it's also a test just to make sure that we can catch an infection before it spreads throughout the community.
Stay home and get tested where you can't find at-home tests. Does the school have a recommended state-sponsored location for tests? So that's a great question. And what we are seeing is that while wait times are long sometimes at CVS and at other drugstores, if you go right to your pediatrician, they can often get you a much faster appointment to get tested. And we will be also posting in Nuts and Bolts some other state-sponsored locations for testing. And we also will be monitoring. We want to know if you're having trouble getting tests. Could you please let our nurse, Lainey Shaughnessy, know that right away if you're going through those channels and not, and we will look into other possibilities. There are also 2 questions about boosters. Today it was approved, which is great news, that kids 12 and up can get booster vaccines, which is fantastic. First, we want to encourage everyone to get their children boosted who chooses to. Do not worry about missing a class to go get boosted or a practice or anything, please, or so-and-so. That is incredibly important to keep numbers down in the community. Can you comment on boosters, Mike?
I can. Before we jump to boosters, I think we missed one question. So there's a question about if somebody recently tested positive for COVID-19, are they removed from the testing pool for 90 days? And I think that that's absolutely appropriate. That's what the CDC recommends. And the science behind that is even after you resolve your symptoms and you're no longer infectious, you can still produce non-infectious, non-viable virus through some of those secondary pathways. And so if you test, and anecdotally, we had an individual in the Department of Defense that tested positive for COVID 49 days after he resolved from symptoms, after symptom resolution. And he was only taking these tests so he could get an elective surgery done. And so you can test positive for extended periods of time, especially if you have a sensitive PCR. So to remove somebody with a previous history of COVID-19 within the last 90 days is an appropriate response. So we do take that into consideration, yes.
Thank you for catching that one. So in terms of the boosters, one of the questions was, are we collecting booster records on students and faculty? We will be asking, just as we asked. We don't want to know, we won't ask why you chose or not chose to have your child boosted, but we will be surveying to ask that, and we will for faculty and staff as well. Here's a question: will asymptomatic, fully vaccinated close contacts be required to test?
Be required to test is, the answer is no, you're not required to test. So the CDC guidelines right now are if you're asymptomatic, if you're fully vaccinated, and they kind of break it out slightly different. So they call it within the 6-month window of your primary series, if you're boosted, and if you're within a 2-month window of Johnson & Johnson, if that was your primary series. For most of the students here, it's going to be Pfizer. So if you're within that 6-month window or you were boosted, then the idea is if you are a close contact, you can just keep doing your thing. You don't have to quarantine. You can put a mask on and for 10 days, stay in that population. If you're fully vaccinated and boosted, you can test on day 5 to end the masking requirement slightly early. But you still have to monitor for signs and symptoms at full 14 days. It's critical because if you have a change in health status, we know that that's a key indicator that you could become infectious to others. So I think that's kind of the component of what the CDC is recommending. For right now, we're still following the state guidelines.
Great.
Until they change.
I think though, Mike, remember we were talking about having tracing and testing going hand in hand. And so because there have been breakthrough cases for fully vaccinated individuals, those close contacts, we will probably be testing as well, which is a change, right? It was a new conversation today.
It is, it's a new conversation as of today. And so there's always the option to test, and testing will absolutely be offered. And so it'll go in combination with contact tracing for very defined situations on a case by case.
Here's an interesting question. Can you get multiple variants of COVID? For example, could you get Delta and then get Omicron some weeks later?
Good question. And the answer is that Omicron seems to have, in some studies, the ability to have a reinfection, specifically not so much with Delta, but with some previous variants that are out there. So Alpha, Beta, the original COVID. We do have a person that I work with whose daughter has had COVID separated out by 3 to 5 months, 3 different times. And she's getting very sick of having COVID and being isolated. So there is the potential. The nice thing is not nice thing, but because of the number of mutations on Omicron, if you get an Omicron infection and you've never had Delta, you will most likely never have a Delta infection because you gain a lot of immunity from Omicron. And they share a lot of similar binding sites on part of that protein. And so the idea is those new variants might have a little competitive advantage, but when you go retrospective, you don't have that same infectious period.
Thank you. So here's another one. PCR tests are difficult to come by these days. What's the best way to get one quickly?
Ooh, good question. So there are PCR tests that you can get. There are 2 specifically at-home PCR tests that are available. One is called CUE, Q Medical, I think it is. And another one is called Lucerna. I can get you those information on them. The Q actually plugs into your cell phone. So if you had your iPhone right here, you have a little plug-in, you take a swab, put in a cartridge, and then snap it in. And it comes with 20 cartridges, probably a little expensive, probably $60 to $80, I guess. But it's a PCR test. It's highly accurate, and you do not require a CLIA lab waiver. You require no laboratory stuff to go with it. So it's an at-home PCR. Same thing with Lucerna. Very similar. You take Lucerna is a 1 cartridge, 1 test piece. Q is a different one. So there are options to buy out there. There's state-sponsored ability, and then if you're having trouble and you absolutely need a test, contact Derryfield School. They can build in some of these test protocols if needed, and if tests are not available because of that testing solution that they've gone with.
So here's a question about accuracy. When a person is symptomatic, are rapid antigen tests of similar accuracy to PCR tests?
Great question. And I had this exact question specific to Omicron that I asked my best friend and also lab consultant. And I asked specifically, are rapid tests when you're symptomatic as effective at picking up Omicron as they were Delta and previous variants? And she said rapid tests are similar efficacy at picking them up. Now there are a few molecular-based tests, so those PCR tests, that have some, I can't remember the exact verbiage, but they do have some issues with picking up a few different sites. So not that they're ineffective, but you might have to run it twice on some of the PCR. So it's challenging, but the lab world knows their stuff. So remember that the rapids are still highly effective. PCRs, depending on the make and model, because there's a bunch of different machines out there. A couple of them have some issues with picking up Omicron.
So just to reiterate, if you're asymptomatic, then you want a PCR, but if you're symptomatic, either will do. Absolutely,
yes. So asymptomatic will pick up very small amounts. So it can pick up before you become infectious to others. It will pick up when you are infectious to others, and a PCR will pick up after you've passed that infectious period, but while you're in kind of a convalescent period. Rapid tests will not pick up before a certain amount. So they do have a threshold you have to meet of shed and viable virus. And then once you take your rapid test, there's a very infectious peak that they are very effective at picking up. And then after that, not so much. So for symptomatic, both tests. For asymptomatic testing, PCRs are a little bit better.
Will the testing for the musical count as the return to school test? Yes, whatever test happens next week for an athlete or thespian, that counts. Another question, we've got a lot of questions, so I'm going to talk faster. If a student has been positive with a potential for ongoing PCR positivity, wouldn't an antibody test be better prior to return?
It's possible. And I say that as not a lab professional, but listening to a lab professional, because there are a wide range of different antibody analyzers that are out there, and they all use different markers. So a 6 on one might be a 200 on another. And so it takes a lot of interpretation and a very good clinician to say this antibody is protective at this level and this antibody is protective at that level based on the analyzer used. And I don't think that we have a ton of data to support that. So my answer is it depends, and I'll touch base with my lab folks and I will get you a better answer.
Let's see. To clarify, if a student is exposed to a known COVID positive case but has no symptoms, should that child be tested before returning to school? So just to be clear, if the student is traced as a direct contact, that means more than, is it 10 minutes or 15 minutes now, Mike?
In the state of New Hampshire, it's a cumulative 10 minutes of close contact within 6 feet.
Within 6 feet in a 24-hour period. If that happens because of an experience at school, and we will trace it and we find out that the student has it, we will test the child. If that child is at home and is exposed to is a direct contact, it would be great if you could test them before returning that child to school. Because again, our number one defense is keeping people who are COVID positive off campus. Will Zoom learning continue through the winter, or does it end with the prudent phase? Okay, so Zoom learning that is designed for 100% of the class to be virtual is happening in the next 2 weeks. Those lessons are really designed for that purpose. After that, our lessons will be planned back to student-centered on-campus learning as the way that those lessons are designed. However, the camera will be open. A Zoom will be open on a laptop, so a student who is stuck at home will be able to hear what's going on in class. It won't be perfect, the visual and the auditory, but it will at least help augment that daily learning plan, and that will be ongoing until we are deeply out of the woods. Let's see, is the testing at Derryfield available the week of the 15th? The testing at Derryfield is available next week, which starts on January 10th. So the 10th through the 14th would be when testing is available here. Will a negative at-home test qualify to return to school? Brad, that is a great, that's from Brad Reed. That is a great question. We would much prefer, and are operating right now on a test that is done by a professional. The reason is that we've seen home tests where sometimes they have 2 negative home tests and then they're positive when the test is done by Lainey here at school, for example. However, if we get into a situation where we can't work with Lainey on it, if you get into a situation where it's really difficult for you to get tested somewhere else, possibly Lainey could do it, come out to your car and do it. We could work with you. Let's see. Can we submit a rapid home? Same question. Okay. Not clear. Can we? Oh, there we go. Again, at home, lots of at-home questions. Why are we allowing our athletes to play unmasked? Why are we allowing other schools into the Derryfield gym without mask tests? Okay, so just point of clarification. The athletes, and as of now, everyone who's going into the Athletic and Wellness Center is wearing masks, including during practice, including on the bench. The only time that we are allowing them to be unmasked is in an interscholastic game. Mike, can you explain why that's permissible?
Can you say it one more time? I'm sorry.
Sure. So that's okay. So the only time that athletes are going to be unmasked is during an interscholastic game, not during practices. They're masked while they play during practice. They're masked all over the place, other places. Why, when we're playing other schools, will that be allowed?
Yeah, great question. And so the idea behind this one is that if we're playing a home game, we can request everybody wears a mask. And that's basically been the league standard, is that the home team sets the rules for what those basketball games, what those matches are looking like. So if you're playing away and the other team says, no, we're not going to wear a mask, at that point, the risk is not the individuals on the Derryfield team. The risk is really, what does this full basketball game look like? And we know that when we have these close contact interactions, when we have these heavy breathing events, when we have a lot going on and sweaty masks start to decrease in efficacy, there's really not much of a difference when you're talking about an indoor basketball game with wearing a mask versus not wearing a mask in some circumstances. And so there's a lot that goes into those deliberate decisions. There's air changes. There's what the school's disease profile looks like. Is it even safe to have this game? And so as we progress and we make those decisions, it's about risk reduction and getting to the right answer for those interactions. And if we can get to somewhere where we can play a mask off team and have those risk reduction pieces and make it as safe as possible, and then layer in testing on the back end to make sure that nothing had happened during that game, we can have some of these interactions. And remember, once again, that there's no penalty for not playing this year. It's really about this being an optional sport, it being out there for academic enrichment. And if something's outside of someone's comfort zone, by all means, you don't have to do it. I know that there's always peer pressure and you want to be there for your team, but not at the expense of your own comfort and your own risk tolerance. So that's kind of the way that we've approached basketball.
All right, here's a question. How many letters of the Greek alphabet would we need to learn before we're out of this?
Oh man, well, we don't need new or another one. I can't remember what it is, but all of them, and then double letters probably. I'm just joking. I think that we're probably, given how these variants are looking and how much they can escape previous infections and how much they can escape our vaccines out there, we're probably looking about another year before we see this being so common that we don't have very much to do with COVID. And I say that because we see our isolation and our quarantine. We've watched it step down from 14 days to 10 to 7 to now about 5. So we see this shortening period because so many Americans, so many people worldwide have been infected with COVID, the original, the alpha, the beta, the gamma. Now we're all the way out to Omicron. So we know that these infections are happening. We know that there's natural immunity. We know that there's vaccine immunity. And we know that as more challenges to the individual happen, we mount a better response, much like we do with influenza. And we saw this as we get our boosters as kids. And then we got to 2009, and individuals that were younger were more affected because we hadn't seen that particular variant before. However, older individuals had. They saw it in the 70s. And so in 2009, when we had H1N1, our older population was protected. Our younger population was the ones that were at most risk. And so it's kind of interesting how our immune system remembers and responds. And so taking those same principles and that same immune response over time, I think that we get to a place probably by this time next year where nobody cares about COVID. As long as nothing extraordinary happens and COVID doesn't become extremely deadly or extremely transmissible or have extremely severe outcomes.
What type of test is given at Derryfield? Is it a PCR test, Mike?
Yep, so samples will be collected. There's 2 samples, lower nose swabs, and it is a pooled PCR test. And they collect 2 samples. One goes into the pool and one stays for reflex testing if there's a positive. So those pools will range between 12 and 25 samples in each pool. And so the company, Eurofins, can go out and they can test multiple samples at one time. And if everybody's negative, an answer will come back within roughly 18 hours. If there's a positive, it's going to take a little bit longer because they're going to have to run each and every one of those specific samples to see which one is positive. So it's not going to be everyone quarantines, everyone isolates. It'll be a very targeted. Mike Klinkshirn was the one that contaminated the sample. He should stay home for the next 10 days.
Unrelated to Prudent Phase, but interested in hearing what Mike can share about any promising studies, research, and commonalities found in folks who've been repeatedly exposed but never become infected. Are there any studies linking Delta 32 mutation to COVID-19?
Oh my gosh. I have been so engulfed in the response to just Omicron that I don't have an answer to this. And I looked at it and I'm trying to think back to my pharmacy days of what we're even talking about here. So I don't have an answer, but I will look that up. I will get it to you.
Anonymous attendee, you have stumped Mike for the night.
You got me, and I appreciate it. I will always tell you when I've been vested, and today I have been vested twice actually, once with lab and antibodies and once with your Delta 32 mutation.
Our school is very much about the growth mindset. It just means it's a new area for you to learn. Does a home test count for the back to school requirement? The answer is it doesn't. And we're providing free testing next week at school. So that should hopefully make that convenient for you, or you can get your own. Is the lunch protocol outlined yet? It is not yet, but that's one of the areas, as I mentioned, that we're going to work on better distancing in the upper school. The middle school, it's a lot easier. They have a lot more space, and that seems to be in hand. Here's a challenge to you, Mike. Let's be honest, masks provide virtually no protection. True or false?
It depends. Great question. So a respirator can provide personal protection. Masks can provide protection from onward spread. So if I'm infectious, they can stop some of those big droplets. And then as long as you're controlling with your HVAC system for aerosols, we can limit these events where spread happens. So the idea of a mask, like a 2-ply cloth mask being the savior for Mike Klinkshirn, better than vaccines is it's not really there. But the idea that if we use masks in a targeted way, so we know those individuals that have a high probability of developing signs and symptoms, and anyone who is symptomatic wears a mask, we can limit spread that way. So I think that the question of will they protect me from getting infected? Probably not. But will they protect me if somebody who's infectious is wearing it? And I think the answer is yes. So that onward spread, they are worth it. An N95 would make me more protected. But simply me alone wearing a cloth mask through the grocery store, maybe not as much.
So in other words, masking is part of a community working together to prevent spread within the community. So that's a way to think about it, of why it's important. Someone wrote that they ordered 4 home tests from the state of New Hampshire yesterday for free. I think this question of home tests, again, if you try to get a test, if you need to test your child because they're symptomatic and you really have trouble going through your pediatrician, going through all the sources that we're going to list in nuts and bolts and all the sources that you can think of to get tested, and the home test is the only option you have, please work with our nurse, work with Lainey Shaughnessy on that, talk that through with her. So it's 7:14. I think this fireside chat definitely attracted the most questions of any that we've had. Mike, thank you so much for being with us. Thank you everyone for tuning in and for asking your excellent questions. And please know that it's a work in progress. We are thinking and working and trying to anticipate to try to create the best student experience possible. If you have other ideas or thoughts, just email me at mcarter@derryfield.org, and we'll take that to the reopening team and put that on the list of things we're continue to work on. So everyone, Thank you for all that you do for Derryfield School. Thank you for being with us. We lead this school all together, faculty, staff, families, kids. And together we will get through this January and have really meaningful learning experiences and meaningful academic and educational experiences, while also surfing the wave that we're in right now. So I am optimistic that this will be a really meaningful month for everyone. Thanks so much for being with us. Mike, thank you.
Thank you very much. Thanks for having me.
Good night, everybody. Thank you.